Moving patients is always kind of not a firm answer with it. There's always a little bit of a gray with it. In general, we don't like to move people that are hurt or sick, but sometimes we have to. And the reason we don't like to move people that are hurt or sick is sometimes it can make the situation worse, especially if they have a neck or back injury. Now, those are pretty rare, so it's not a huge concern, but it is enough of a concern that if we don't have to move them, we don't want to. Occasionally it can make things like bleeding and broken bones, and sometimes even somebody like having a heart attack feel worse. So again, we don't want to move them if we don't have to, but there are some situations where we do. Now, if it is something that is not safe, like you come upon a car wreck and the car is on fire and you want to go in and rescue them, I'm not going to tell you you have to do that. You certainly don't. You never have to do anything that you don't feel is safe. But if you feel you want to, that would be a time where you probably need to move the person first and not really worry about neck and back injuries and bleeding and all the rest of that. We call it a life over limb situation. Now, those types of moves are what we call emergency moves. You're going to get a chance to practice a couple of different types. We have usually a blanket drag or a shirt grab that we will use. I think I said shirt drag, that we will use for emergency moves. And then we have non-emergency or non-urgent moves. And these are more, maybe somebody has fallen down and hurt themselves a little bit, and it's the middle of the driveway and it's very hot and you just need to get them out of the way, but it's not something that you have to do to save their life. And in those situations, we can take a little bit more time and be a little more cautious with moving them. So again, we have emergency moves, which is if something's not safe. And the one that always comes to mind for me is we were trying to cut somebody out of a car one night that had gone off into a ravine, and we were cutting away on it, and I looked down, and right between my feet was a big rattlesnake. And that suddenly became an unsafe scene for me, and we got out of there, and then we figured out how to get rid of the snake so we could move the patient. But that became a little bit more urgent. But there are other times that you can have emergencies where you have to move somebody to help save their life. But generally, we try not to move them. Again, if it's something that's a life-threatening event or life-threatening situation, we have emergency moves. If it's not so life-threatening, then we have what we just call regular or non-urgent moves. So again, you have to decide. You have to make the determination whether you want to move someone. In general, try not to. In a couple other videos, you're going to see how to do emergency and non-emergency moves, and this is something we'll get to practice in class.